And I'm going to reframe your question a little bit, because neograft is just, it's kind of like using the term Kleenex for a facial tissue. Neograft is one form of powered follicular unit extraction. Let me back up a little bit. The traditional surgery for hair transplant takes a small bit of tissue from the back of your head, where your hair is permanent, and you use those individual grafts to fill in an area that is less permanent, or where you've lost hair, typically at the front of the head. Now, you can take out hairs individually, one at a time, or grafts individually, one at a time, from these same areas. It takes an experienced hand, and it uses a very small device called a punch. And these punches are, when I say very small, they're on the order of maybe a millimeter in diameter. So what you end up doing is centering the hair. A punch is like the interior tube to your toilet paper roll, only on a very microscopic scale. And what you do is you center the hair within that tube, and you kind of dissect it a little bit, and then you gently pull the graft free of the scalp. And when you do a hair transplant this way, it's extremely tedious, but all that it leaves as a wound on your scalp is that little tiny hole, usually about a millimeter wide. It can be a little bit smaller or a little bit larger, but a millimeter wide, where that graft was. And nobody typically notices it. So you can do this manually. It takes great hand-eye coordination. You have to be able to visualize what the hair looks like underneath the surface of the scalp. And it requires a lot of practice. So typically I would go to someone who has a lot of experience in this area, who's been doing follicular unit extraction for quite a while. If you are somebody who wants to really wear their hair short, follicular unit extraction is a very good option for you. And the difference between the powered follicular unit extraction and the manual method, and by that I mean the manual follicular unit extraction method, is very simple. With the powered FUE, you have a motor attached, and you can harvest a lot more hairs or get a lot more grafts per session than you would be able to otherwise. Like I said, this is extremely tedious. During the manual method, I myself am rotating this punch. During the powered FUE, whether it's NeoGraft or SafeScribe, or there's a bunch of them out there, whether it's any of those different kinds, then you have a machine helping the doctor. Now, this machine does not do it on its own, although there has been some talk about a robot that would be able to do this, because, like I said, it's a long day. But as it is right now, the powered follicular unit extraction just is a little motor, a little handheld motor, assisting the doctor with getting those grafts for you so that they can be transplanted so that they can grow elsewhere.